This
at New
conference will now be recorded.
Government of Karnataka sponsored Key-Based Urban Project for Upgradation of Research Analytical Lab. Government of Karnataka sponsored Pharmacogenetics study of variation of karma with various available healthy volunteers by UG spectrometer. There is also research collaborations with BV Pharmacy, Public Board, and Karnataka University, Dharwad. Third has awards into his list, mainly Vaidya by Sri Sangabasava Madhya Savadi, Belgavi, in the year 2000. Sir has more than 18 research publications, amongst which estimation of total alkaline in Chitrakartivati by UG spectrometer in the year 2012, action of Shirodhara, a hypothetical derivative in the global and GLS red flags and Indian, generalized skin rash after oral medication or administration of Ayurvedic drugs, skin rashes after application of Kotam Chukadi Tela, etc. Sir has been used for some conferences at international and national levels. Worked as a resource person at a workshop on pharmacogenetics studies conducted at ALU BMK AMC in the year 2019. Sir has many oral presentations at national and international seminars. Sir has working experience as coordinator for Institutional Ethics Committee for Research on Human Subjects, RGHS AMC RON. Sir is working as coordinator for Institutional and Animal Ethics Committee RON. Sir has developed research environment at RGES Ayurvedic Medical College and PD Research Center RON by establishing a new analytical lab, Animal House, and bring new government projects. Sir has academic achievements like developed research lab under RGES AMC RON, done median work on pharmacovigilance in Ayurveda, presented various seminars on Ayurvedic pharmacovigilance. He has guided more than 22 PG scholars as a guide for their research dissertation. Sir is now working as a Central Research Officer, come Associate Professor at RGES AMC Road since 2013. I welcome you, sir.
Thank you. Shall I go ahead?
Yes, sir.
Okay. Thank you, Dr. Divya. I respected Principal Sir, Dr. Ganesh Shetty Sir, and respected Vice Principal, Dr. Advesh Arkere, and HOD, Dr. Pushkar, and all the teaching staff of SBG Ayurvedic Medical College. I thanks those who have invited me for the sharing my views on pharmacovigilance on this particular webinar. Coming to the topic, you all know pharmacovigilance is nowadays very booming subject where whenever we want to call the any medical system as a scientific, so we need to implement the pharmacovigilance in a systematic way because pharmacovigilance will help us to make the system very safer and make the any system in a globalized science. So that is what the importance of pharmacovigilance. So we'll discuss that. What is this pharmacovigilance and how it has to be implemented in Ayurveda and what are the usefuls in Ayurvedic sciences. So before to start the actual pharmacovigilance, first we need to understand what is going on in the field of Ayurveda, because these instances will help you to importance of Ayurveda. I mean pharmacovigilance. So there are so many developments are occurred in the field of Ayurveda, like heavy metals contents of Ayurvedic herbal medicine product, and lead and mercury and arsenic in US and Indian manufactured Ayurvedic medicine sold via internet. So these are the publications which are published in very reputed journals like Journal of American Medical Association. So they actually claim that Ayurvedic medicines are not to be safe as a human consumption because they containing heavy metals like lead, mercury, etc. So these actually, claims later these claims many of the European countries have banned of Ayurvedic medicines to be marketed in their respective countries. So this is, these claims need to be answered. So being a Ayurvedician, we have need to be answered this question why this particular claims are arising. So the ultimate goal or ultimate answer for this claiming is to implementation of systemic pharmacovigilance in the field of Ayurveda. So we'll discuss that. And there are other developments that are also occurred. Every day one or the other journals will publish one of the bad reports on the Ayurvedic sciences. Like for example, subacute thyroiditis following ginger consumption. So we know that ginger is a very basic drug. We used n numbers of medicines in the treatment, many numbers of diseases. So hence, this claim says that simple ginger consumption will lead to the subacute thyroiditis. So how this particular issue has occurred and what could be the cause? So we need to assess and we have to tell the public that these are the improper administration. Hence, there is a need to be occurrence of adverse drug reaction. So whenever if you implement the pharmacovigilance, then only we can tell the public that these are the instances. Hence, there is a need of implementations of pharmacovigilance. And there is one more publication, case series and review of Ayurvedic medication induced liver injury. So this is also published in one of the very reputed journal, BMC Complementary Medicine and Therapies, that is British Medical Council. So this is also very reputed journal. They actually claiming that Ayurvedic medicines are not to be safe. So when the any common people, if they read this particular article, definitely they will think that these medicines are toxic. So hence, being a Ayurvedician, we are the authoritative to be tell the public that why these particular instances are occurring because of improper preparation of the medicine, improper usage of the medicine. Okay, very recently there is an article published in Journal of Clinical and Experimental Hepatology, that is herbal human booster induced liver injury in the COVID-19 pandemic, a case series. This has been even published in TV news and even various newspaper. They claim that simple guduchi, the Tinospora cardifolia, by use of Tinospora cardifolia, it has created a liver injury. So this is very recently published. So how it has to be occurred, what could be the cause? So we need to assess it only through the pharmacovigilance. So hence there is a lot of potential subject is need to be implemented in the field of Ayurveda. And there are other developments like Indian herbal remedies for the diabetes as a cause of lead poisoning. So if you go through the Google, there are so many claims are coming. So all these claims, we are the authoritative persons to answer it. So hence, there is a systematic implementations of pharmacovigilance in Ayurveda. And there is a few more claims. The Steven Johnson syndrome due to the Ayurvedic drugs. Indian Journal of Pharmacology, 2012. So these are reputed journals. They claiming that Ayurvedic medicines are not safe. European countries have banned in marketing of Ayurvedic drugs. Later, so many claims, many of the European countries have banned. Later, Indian government has intervened and they revoked it. So these are the claims, and along with that, in common people, there is a belief that Ayurvedic medicines are safe. Do you think Ayurvedic medicines are safe? Although Ayurvedic products are prepared in a very sophisticated manner, where the shodhana is told and how it has to be administered, but there is a chances of the person is tendency to take the different pathis medicine, like allopathy medicine plus Ayurveda medicine. So there may be a chances of interaction. So hence, none of the medicine is safe unless and until if you know the qualities of the drug. This is what the Charaka said. So hence, every drug has a chance of producing good effect and bad effect. So you must understand. So when it has to be used, how it has to be used. So this all information will be gathered through the pharmacovigilance only. And there are other claims that negative criticism of Indian Ayurvedic products. So because of not implementations of GMP, improper production of the drugs. So all this will lead to the Ayurvedic products are substandard. So to answer this, there is a systematic implementations of PV. And nowadays, recent practice of Ayurveda in present scenario. The olden days, how the physicians have prepared their medicines for the patient. So they used to visit to the forest and they used to collect the genuine drug and they used to prepare the medicine. Nowadays, we have to depend on pharmaceutical companies. So what the drug they are adding, which drug they are using, how they are preparing, we don't know. We directly go to the market and purchase the particular Chavanaprasha. So whether they are containing real amalaki or something else, we don't know. So we cannot believe this. So unless and until if you know the qualities of the drug and if the particular drug is appropriately prepared, so we can expect wonders. So that is not happening in current scenario. So once if you implement the PV pharmacovigilance, so you systematically you can make a regulation so that the particular medicine has to be prepared so and so guidelines. So that's what the importance. And extension of Ayurvedic medicine, that is 80% of populations in India depend on traditional medicine. out of which 70 to 75% depend on Ayurvedic medicine in one or the other form. So that means in Indian population around 75% or population are directly dependent on herbal drugs. So hence there is a tremendous benefits is in India. That means there are so many herbal consumers are there, but how they are using we don't know. If anything goes wrong, ultimately they will claim that Ayurvedic medicine has created this hazard. So hence there is a systematic way of approaching this particular claims. So hence there is need of pharmacovigilance in Ayurveda. And there are you must have come across news channels or televisions or even newspaper, so the false and misleading advertisement, they claiming that Ayurvedic products, it can cure the HIV, it can cure the COVID-19. So all these claims are no, you will be seeing this. So unless and until there is no scientific data, so these claims should not be entertained. If at all these claims are there, you have to report to the PV. The PV will take care of these claims. So this is what the importance of PV. So before to start the actual pharmacovigilance, the whole and soul of pharmacovigilance is nothing but adverse drug reaction. That is the occurrence of unintended drug reaction. So if you use the drug for the treatment, but instead of curing the disease, it created something else. So that instance are called as adverse drug reaction. We'll discuss that. So what are the consequences of this particular adverse drug reaction in current scenario? So in US, the cost of hospitalization per case with adverse drug reaction around $22,775. So without ADR, 17,000 plus. So that means the drugs which are using for the cure of the disease, it has created something else or some other diseases. To get rid of that disease, again, the person need to be spent extra amount. So this is financial burden to the particular individual. So hence there is need to be minimize this occurrence of adverse drug reaction. So hence PV is important. And especially in India, hospitalizations due to adverse drug reaction per patient is around 150. So $150 in Indian population, they are spending extra amount to get rid of the drug induced toxicities. So this is what the importance of this particular science. And these particular adverse drug reactions were 4 to 6 largest cause of death. So we have seen the cause of death like cancer, RTA or other region or tobacco. So but this is one of the cause of death, and that is actually 4 to 6 largest cause of death. So this particular cause of death can be preventable. This is medicine induced death. So this has to be get preventable. So hence how you can prevent it by implementing the pharmacovigilance. And in India, 3.7% were adverse ADR detected patients in hospitalized, out of which 1.8% are fatal. So out of which approximately 2 patients are died due to the drug-induced toxicities. So this is what the you can prevent it. And what about the Ayurveda? So there is only one study which is existed, so which we have conducted in KL Ayurveda Hospital. Pharmacovigilance study in Ayurvedic medicines in Ayurvedic teaching hospital. So this has published in IU. So this particular study, concluded that so in Ayurvedic inpatient admission, so approximately 1.18 percentage, 1.14 percentage of Ayurvedic medicines do create a occurrence of adverse drug reaction. So if the particular hospital, if the 100 patients are admitting, so out of which approximately 1% are getting drug induced adverse drug reaction. So this can be preventable. So although this is very less or very low number, but this can be preventable. So how it can be preventable? By implementing pharmacovigilance. So now start the discussion about the adverse drug reaction. So what is this adverse drug reaction? So you may get confused between side effect and adverse drug reaction. Side effect means the drug which is already known the unwanted effect. Okay, along with the beneficial effect, the drug is already known for the unwanted effect. This is what called as side effect. Very good example is simple paracetamol. The paracetamol is a antipyretic drug. The same paracetamol has a side effect of liver toxicity. The liver toxicity nature of the paracetamol is a side effect. If the same paracetamol, if it is induced any skin rashes, that is what called as adverse drug reaction. The definition according to the WHO, a response of the drug that is noxious and unintended and that occurs at the doses normally used in human for prophylaxis, diagnosis or therapy of the disease or for modification of physiological function is called as adverse drug reaction. See, once again I repeat, the response of the drug that is noxious and unintended, that should not be happen, but it has occurred. Okay, and unintended, that occurs when it has occurring if the drug is used in a normal dose. For what purpose? For the prophylaxis, preventive purpose, or diagnosis purpose, or therapy of the disease, for treatment purposes, or any physiological modification. Okay, so all these purpose, any purpose you use the drug in a normal dose, if it is created unintended response, not reported response, that is what called as adverse drug reaction. See, one more definition, that is FDA definition. They actually included even overdose. The same meaning is same. In WHO definition, they have included only the normal dose, but FDA definition, they have included even overdose, drug abuse, drug withdrawal, and drug failure. So all these are also included in the adverse drug reaction definition. Then what is the difference between adverse drug reaction and adverse drug event? Adverse drug event is important whenever you start learning the pharmacovigilance. Okay, the pharmacovigilance nothing but identification of the adverse drug reaction and how you can make them the prevention of this particular adverse drug reaction. So once you want to understand the adverse drug reaction, you also need to understand the adverse drug event. So event is any unfavorable and unintended sign, including abnormal laboratory finding, symptom, or disease temporarily associated with the use of drug, whether or not considered related to the product. This is what called as adverse drug event. I would like to explain this particular event with an example. Say for example, a person is consumed the alcohol, he also consumed the antihypertensive drug. Okay, so at a time he consumed the both antihypertensive and alcohol. So later he met with the accident. Okay, so you claiming that the person has taken this particular antihypertensive drug, so this is a event. Okay, so whether the particular event, that is accident, could be because of a drug or because of a alcohol. So once if you analyze the cause and effect relation, then only you came to know that the event could be because of a drug or something else. So this event is called as event. So once if you understand this could be because of a drug, then it is what called as adverse drug reaction. I hope it's clear. So all the adverse drug reactions are adverse event, but are the events are not ADR. Okay, here the example, here the accident could be because of alcohol, not because of a drug. Okay, so this is what called as adverse drug event. Then classification of adverse drug reaction, there are two classification, basic classifications are there. The first one is based on pharmacology, that is based on how you are explaining with the adverse drug reaction, that is type A, B, C, D, E, F. Type A is augmented reaction. This is predictable on the basis of known pharmacology. Augmented means you can explain how this particular event has occurred. Okay, like for example, Ballataka is known to cause the skin rashes. Okay, this is if the event is occur, so you can claim that this particular event could be a type A reaction of adverse drug reaction. That is, you can explain. And Pitta Prakriti, it is by nature. So once if we use this particular Ballataka and Pitta Prakriti, there is a chance of skin rashes or blister. So this is augmented. Bizarre is unpredictable or idiosyncratic reaction. Cannot be explained on the basis of known pharmacology. So you cannot explain how this particular event has occurred. Very good example I can quote is Shatadauta Gruta. This has been reported in KL Ayurveda Hospital. Shatadauta Gruta, you know the Shatadauta Gruta is one of the best drug for the treatment of skin diseases, especially Kaphaja Vikaras. So if the Shatadauta Gruta has created skin rashes, okay, so you cannot explain it. Shatadauta, instead of reducing the rashes, it has aggravated the rashes. So this is what called as bizarre reaction. So this is type 2 reaction or the second type of classification. So type C is chronic usage, develop with a long-term therapy. So that is chronic usage of the drug. D is delayed effect. The effects such as carcinogenicity, teratogenicity, all these falls under this particular delayed effect of the drug. Type E is end of use. So such reaction occur after the stopping the use of the drug. Very good example, withdrawal symptoms. Withdrawal symptom example, Triphala Churna. So Triphala Churna, if you use for the constipation or Vibandha, so later in a span of 1 month, if you suddenly stop the Triphala Churna, suddenly there is aggravation of Vibandha, constipation. This is what called as withdrawal symptoms. or type F is failure. So this related to the unexpected failure of the therapy. So instead of reducing the temperature or reducing the vyadhi, so it doesn't do anything else. So that is what called as failure of the drug. And second classification based on severity, mild, moderate, and severe. So mild reactions are nothing but bothersome but require no change in therapy. So mild means you need not to worry. You need not to give any medication. So if you stop the particular drug, ultimately the event will be subsided. That is what called as mild. Simple, very good example is skin rashes or mild skin rashes. Okay, or any redness of the eye, okay, or too much sleep. So these are called as mild. Moderate means require the change in therapy, additional treatment or hospitalizations are required. So like loss of limb or any bleeding tendencies. So all these are moderate because there is need to give the additional treatment or the patient need to be get hospitalized. Severe means disabling or life threatening. Okay, these are called as severe reaction. So now the actual pharmacovigilance. So these are the basic, definition which are comes under pharmacovigilance: adverse drug reaction and adverse drug event, etc. So now the pharmacovigilance. The pharmacovigilance, it has two terms, that is pharma plus vigilance. Pharma, you all know, pharmacology. This means pharma means it is a drug. Vigilance is to keep watching or to watch the particular event. Okay, so pharmacovigilance means drug, how the drugs are behaving in market. So you closely monitoring the drug. So this is what called as pharmacovigilance. Any drug want to liberate into the market, there are so many research need to be conducted. Type 1 or clinical trial, stage 1, stage 2, stage 3. So you all came to know once the vaccines are being developed. So there will be a various stages or clinical trials need to be conducted. So after the passing the phase 3 clinical trial, the drug is now ready to liberate into the market. Okay, so once the particular drug liberate into the market, so the drug need to be monitored very closely. So in research, it has to be monitored in a closed environment. So if it is liberate into the market, there will be a tremendous consumption will be there. So many people will start consuming it, and so many racial people will start consuming it. So many religion people will start consuming it. So how they are behaving, so unless and until if it is monitored, so this is what called as pharmacovigilance. That is fourth phase of clinical trial or closely monitoring of the drugs. The definition is, so this particular pharmacovigilance is a science and activities. It is not a study. So it is a science which related with the activities relating to the detection, evaluation, understanding and prevention of the adverse drug reaction or any other drug related problem. So, in pharmacology, there is a study of drug, but here the pharmacovigilance, it is not study. It is a science and activities. Here the work, there will be a, group of people will start clubs together and for performing the work. This is what called as performing the work on detection of the adverse drug reaction, evaluation of the adverse drug reaction, understanding of the adverse drug reaction and prevention of the adverse drug reaction or any other drug related problem is called as pharmacovigilance. You need to closely watch this particular detection, evaluation, understanding and prevention. We'll discuss that how these particular activities need to be conducted. So how this pharmacovigilance is evolved. Previously the pharmacovigilance, it is a very new branch of pharmacology. Previously this particular branch is not there. So only this has been happened to occur in the after the drug instance of thalidomide disaster. So this particular thalidomide is a very best drug for the treatment of morning sickness in pregnant ladies. This was launched in 1956 for the particular indication of morning sickness. So in 1959 to 61, there were so many reports are reporting the fetal's abnormalities. The babies born with a short lip, you can see on images. So these reports were reported in European countries, so maximum in Germany. So then later they start looking back, reverse pharmacology, what could be the cause? Then they find the cause is because of the in pregnancy they are consumed the thalidomide. The thalidomide has created the genetical modification of the babies. So hence they made the strict laws or regulation to monitor the once the drug being marketed into the market. So hence in 1962 the USA revised the laws to requiring to prove the safety and efficacy before issuing the marketing authorization. So later they made the mandatory for toxicity studies of the or post fourth phase of clinical trial, post market studies. So they have made mandatory so that you can early detection of these particular cases can be preventable in future occurrences. In 1963, the British Committee on Safety of Drug Monitoring is developed, and in 1964 they have started voluntary reporting. The UK has started yellow card system, and Australia has started blue card system. So the card will be available in every hospital. If at all any report, any issues are occurred due to the consumption of drug, so instantly that card need to be filled and dropped on a drop box, so that the committee member will look into the issue, so that you can prevent the future occurrence of this particular drug induced toxicities. So this is what the pharmacovigilance. And in Ayurveda, 2008 Department of Ayush and Ministry of Health and Family Welfare has implemented. They have prepared the protocol for pharmacovigilance of ASU. So they have included only Ayurveda, Siddha and Unani drugs. And in very recently in the year 2017 and 18, the Standing Finance Committee chaired by Secretary Department of Ayush approved the scheme on November 2017. Subsequently, it was ruled out the implementations of in the country near the end of the financial year, that is 17 to 18. And they actually renamed this particular pharmacovigilance program into Central Sector Scheme for Pharmacovigilance of Ayurveda, Siddha, Unani and Homeopathy. So they have included homeopathy. So previously it was not there. So previously the National Pharmacovigilance Center was Jamnagar. The later this has been shifted to the All India Institute of Ayurveda, New Delhi. And what are the objectives of this pharmacovigilance? There are three types of objectives: short term, medium term and long term. The short term objectives are to develop the culture of adverse drug reaction notification and reporting. They are actually motivate the clinician and students and health workers to develop the culture of report to the adverse drug reaction. And the medium term is to involve the healthcare professionals and professional association in drug safety monitoring and information dissemination. The second objective is to motivate the other health professional like pharmacist, nursing staff or other allied workers, and they are actually motivate them, and the information need to be disseminated to the other health workers so that we can prevent the future occurrences of drug induced consequences. And the long term is to achieve the operational efficiency for making pharmacovigilance a benchmark for global drug monitoring endeavor. So this pharmacovigilance for Ayurveda making the global endeavor so that Ayurveda become globalized. And the main aims of pharmacovigilance to develop the culture of documenting the adverse effect and undertake the safety monitoring of Ayurveda, Siddha, Unani and homeopathy drugs, and surveillance of misleading advertisement appearing in the print or electronic media. See, the aim is to develop the culture of documenting. So first you need to identify the adverse drug reaction or any safety problems associated with Ayurveda, Siddha, Unani and homeopathy, or any misleading advertisements. They claiming that Ayurvedic, this particular drug of Ayurveda is a creating wonder. It may be either a print version or electronic media. So that is need to be documented and you have to prevent it. So that is one of the aim of pharmacovigilance. And also they improve the patient and public care and safety. So improve the patient care and public. Assessing the risk benefit and promoting understanding education including clinical training in pharmacovigilance and its effective communications to the public. So how you can risk and benefit by using the drug. So that assessment need to be done, and what could be the beneficial to the public. So that is what need to be disseminated to the community. And early detections of unknown safety problem, identification of the risk factor by using the drugs, quantifying the risk, detection of increase in frequency, how frequent this particular event is occurring. So that is what need to be detected. Possible mechanism underlying the adverse drug reaction, estimation of quantitative aspects of benefits, risk analysis, and dissemination of information needed to improve the drugs prescribing and regulation. If without diagnosing, without proper diagnosing, improperly prescribing the drug, so that create a bad name to the Ayurveda. So there is a need of making the regulations to prescription. So that is also one of the aim of this pharmacovigilance, preventing the patients from being affected unnecessarily. So extra burden to the public, so that also can be preventable by the pharmacovigilance. Then how the different sectors of the institute are working under this particular pharmacovigilance. So pharmacovigilance in ASU and H drugs hierarchy. So here, Ministry of Ayush is the program management unit. Okay, the National Pharmacovigilance Center, which is All India Institute of Ayurveda, New Delhi, that is one. And there are 5 intermediary pharmacovigilance centers are there. They are National Institute of Ayurveda, NIA Jaipur, IPGTRA Jamnagar. These are 2 for Ayurveda, and National Institute of Siddha, Chennai, and National Institute of Unani Medicine, Bangalore, and National Institute of Homeopathy, Kolkata. So these are respective homeopathy, Siddha, and Unani medicine. For Ayurveda, 2 regional or intermediary pharmacovigilance centers are there, and there are 42 peripheral pharmacovigilance centers are there. So like different peripheral pharmacovigilance centers are there. For Karnataka, we have Keli Ayurveda Hospital, Belagavi, and SDM Ayurveda Hospital, Hassan. So they are actually 2 peripheral pharmacovigilance center, and recently they have even included JSS Ayurveda Hospital, Mysore, as a peripheral pharmacovigilance center. So this is how the whenever the any event is reported or identified, so initially you have to go to the peripheral pharmacovigilance center, your nearest peripheral pharmacovigilance center. Later they will assess it, they will send it to the intermediary pharmacovigilance center, then they will report it to the National Pharmacovigilance Center. So each center will take the different decision. So initially it will be done on peripheral center, and later in intermediary center they will collect the similar varieties of report and make a conclusion. And later in the decision will be taken place at National Pharmacovigilance Center, whether the particular drug could be because of the event or not. If it is because of the event or drug, so they will withdraw the drug, marketing of that particular drug. So that decision will be taken by the National Pharmacovigilance Center, and they also report to the Ministry of Ayush. So this is what the hierarchy of the particular pharmacovigilance program in Ayurveda. So what is the importance in Ayurveda? Already I told that there are several misconceptions and doubt prevailing regarding the safety and efficacy of Ayurvedic practice. Like few misconceptions among the community are like drugs of Ayurveda are safe and need not to be taken under medical supervision. So there are some common misconceptions among the people. Any drug of Ayurveda without prescription you can get it. Okay, like simple garlic without the doctor's prescription. If the particular patient is taking warfarin or ecosprin along with the garlic, if you consume, ultimately it will lead to the bleeding tendency. So ultimately you claim that this garlic has created the bleeding tendency of Ayurvedic garlic has created the bleeding tendency. You are claiming that Ayurvedic drugs are not safe. So this is what the importance of PV. Ayurvedic medicines don't have expiry date. So these are some misconceptions. So all these need to be addressed or answered. GMP is not required for manufacturing of Ayurvedic medicine. Few JAMA articles and European studies have raised the issue of heavy metals contaminants of Ayurvedic medicine. To answer this, so there is a need of systematic implementations of pharmacovigilance. Ayurvedic medicines may be administered along with the other system of medicine as they are safe. No? Do you think that Ayurvedic medicines are safe? So you can consume with other system of medicine? No, it cannot be, because there are so many types of interaction can occur. We'll discuss that. No dose limitations for Ayurvedic medicine. Ayurvedic medicines may be taken for any duration as they are safe. So these are some misconceptions. So even Charaka, he itself says that Sarva Dravyam Panchabhautikam. So any dravya is a Panchabhautikam. So whenever if you consume the particular drug, so definitely it will create something differences in the body. So whenever you consume without knowingly, so ultimately it will create unwanted effect. So hence there is need to be monitored very closely. So here Charaka says, Yata Visham Yata Shastram Yata Ragni Rasharirata Tataushadam Avidnyatam Vidnyatam Amrutamata. Charaka Sutrasthana, first chapter. So he says that a strong poison can become an excellent medicine if administered properly. On the other hand, even the most useful drug can act like a poison if handled carelessly. Okay, so you must know the qualities of the drug. If you know the qualities of the drug, you can create wonders. If you don't know the qualities of the drug and blindly you prescribe it, so ultimately it will create like a poisonous or shastra or agni. How the all these three instrument will create a hazard. So similarly, even a simple drug also create the diseases. So that's what Charaka says. औषधम अनभिज्ञातं नामरूप गुणस्त्रिभिः विज्ञातं चापि दुर्युक्तं योपमर्थमध्यते. So any matter in the universe can be administered as a medicine if the properties and characters are known. If you don't know, so if you are blindly prescribe it, so ultimately it will create a diseases. So hence you must know the science in a better way so that you can prescribe the drugs. Ultimately you will not get the or you can prevent the occurrence of adverse drug reaction in Ayurveda. So let us start the actual pharmacovigilance activities, that is detection, evaluation, understanding and prevention of adverse drug reaction. So first one is detection. How you can detect the adverse drug reaction? There are so many varieties of detections of adverse drug reaction. The detection is also called as signal generation. That is initial identification of the any drug related problem are called as detection. So spontaneous reporting technique, post market surveillance technique, prescription event monitoring, case control studies, cohort studies, intensive hospital monitoring technique, record linkage, meta analysis and RCT, that is randomized control trial. So these are initial identification of the drug induced problem. So we'll discuss one by one. So this is the reporting form which is available in National Pharmacovigilance Center or peripheral pharmacovigilance centers, and even in online also this particular form is available. Whenever in your day-to-day practice or your clinical visits, if any patient is claiming that by taking this medicine I get this reaction, so you have to fill the form and you have to report it to the nearest pharmacovigilance center. So this form actually including patient name, patient information, IPD, OPD number, address and age, prakriti, sex, etc. and clinical condition and drug description of the drug event, ADR event, and date of initial identification and drug dispensing and concomitant medication, concomitant diseases. Okay, all this related, case sheet. So what you are seeing in a case sheet, everything is including along with drug information. Which drug he has taken, what is the batch name, who is the manufacturer, when it was given, how long it has to be continued, does the Anupana was used or not. Okay, so dates of starting, when it has been stopped, reason for use, any other remarks. So all these need to be filled. And the last is the reporter's information. Who is reporting it? The name of the reporter, address, telephone number, email, signature, and the date. So this will be the reporting form which is available. So this is what the same pharmacovigilance ASUH drugs reporting form. So this also form including misleading advertisement submission format. So any advertisement misleading the Ayurveda, like name of the Ayurveda Siddha Unani homeopathic drug, it is misleading. Name of the advertiser, advertising authority, manufacturing, marketing agency, contact details, etc. Medium advertisement, whether it is a printed version, electronic, TV, visual, audio visual, or only audio. So what type of advertisement? Content in the advertisement. So what content it has? Okay. Then the references, source of advertisement, date of advertisement, publication, telecasted date, etc. Language and copy of advertisement. If it is video link or any paper news or any printed version need to be provided, and month and year center. So these are the information for the misleading advertisement format. Then the spontaneous reporting technique. So how it has to be done? Here the spontaneous, the alert the patient or the health professional, connect an undesirable medical event with a drug exposure and report his or her suspicious to the pharmacovigilance center. So initial identification. So you are, in your clinical visit or even clinical practice, so any patient is reporting there that if I take this particular medication, I am getting this reaction. So that initial identification instantly need to be documented and need to be reported. This is what called as spontaneous. So this is voluntary reporting system, yellow card system in UK and blue card system in Australia. So there will be cards are available, so you have to fill it. So initial to the pharmacovigilance drop box. So this is what the spontaneous reporting technique. There are some advantage and disadvantage. We'll skip that. Uh, Advantage here, the target the larger population, can cover all the medication, okay, and it is inexpensive, and drug interaction can also be, you can note it down. Hospital and outpatient care, like OPD level patient care also can be monitored. Disadvantages: under reporting. If I report, my name will goes to the wrong, or my name will be hampered. So this will lead to the under reporting, okay, or bias, difficult to detect the delayed reaction. So all these, reaction with the high background incidents will be disadvantages. Second method is post-market surveillance. So here the post-market surveillance means the drug, after the approval of the drug, the now drug is liberated into the market, the fourth phase of clinical trial. So here the first consumer of the in marketed drug, around 5 to 10,000 first user. So they will closely monitor that particular consumer. So these are called as post-market surveillance study, often followed by the manufacturer and follow for up to months and years. So this is a long duration study. Data submitted by regulatory authority. Strength here is provide the incidence, and drawback: no control group, often promotional. If the manufacturer are performing, they will not claim that my drug has created this disadvantages. So hence they will subside it. So hence these are the disadvantages of post-market surveillance study. Third one is prescription event monitoring, or PEM. So non-interventional prospective observational study. So here the prescription, the physician has prescribing the drugs, the third person will go and observe the prescripted drug, which drug he has prescribed and what are the consequences. Okay, this is what called as prescription event monitoring. Specific drug under scanner, target up to 10,000, real world clinical outcome data will be generated, and here the hypothesis generated. So if the particular drug is created this reaction, so you can generate the hypothesis what could be the cause. Okay. Okay, so this is about the prescription event monitoring. So for here the method is, there will be a forms are available. So these forms are dispatched to the prescribing physician, and completed forms submitted to the authorities, and patient identity is codified. So you should not disclose the patient identity. So this is what the method of prescription event monitoring. Here all the events are documented. Death by from any cause also need to be documented. Hospitalization, fetal abnormalities, change in laboratory findings, all this will be recorded. Here the detect the unexpected event, provide the incidents of occurrence of adverse drug reaction. Drawbacks: limited size and irrelevant comparison. And the fourth category is case control studies. Here the case and control, identifying the patients with the outcome, identifying the disease-free control. For example, 10,000 populations first consumer are there. Okay, so 10,000 of the same disease. So they will, out of 10,000, 100 populations are suffering with this particular reaction. And the same you need to compare with those who are same disease, those who are not taking the particular drug. So this is case and control. So you can compare. So this is what called as case control studies. So here provide the relative risk, study multiple exposure and least costly. The drawbacks is bias and control is a single variable. Fifth one is cohort study. Here the identify the exposed patient, identify the non-exposed patient, controls. Compare the occurrence of the control. Strength is provide the incidence, determine the causation, many outcomes simultaneously will be get. And drawbacks are time consuming and costly. And the last one is intensive monitoring technique. So that is that any person which is designated for this particular monitoring technique will go and visit the particular hospital personally and see each patient very closely. So they will collect the demographic, social and medical information from the consecutive hospital admission. So they will closely monitor the admitted patient. Okay. So for example, in your hospital, so in that particular date, 100 patient has been admitted. So these 100 patient, what are the drugs they are taking? and how many patients are getting the any reaction induced by drug. So they will even take the demographic and all other medical information. So this particular technique they provide us with comprehensive information of hospital drug use, and drawbacks are size and cost. So you cannot conclude that only 100 out of 100 patient these many are the ADRs. So that is the only disadvantage. Record linkage, here the computerized, so you can make the your computerization. So how many patient they are consuming this particular leave 52, okay, in your hospital. So how many patients are in follow up, they will show the are taking the follow up medication, and how many are getting any reaction. So this is what called as you can link the records. At the end of the year you came to know in 1 year in our hospital, so these many patients are taking leave 52, and out of which these many patients are taking the second dose, these many are third dose, and these many are end up with this particular reaction. So you came to know in a fingertip. So this is what called as linking the record. Here the strength, speed and low cost, missing or incorrect information will get, exposure or the diagnosis data. So that also will be very difficult, and variable, like person is consuming alcohol, non-veg diet, etc. cannot be ruled out, or any allopathic medication cannot be ruled out. Representativeness or size. So these are the difficulty of the record linkage. The last one is meta-analysis. Here the combining the results from the group of studies. There are so many studies are you need to screen on any PubMed or any research journals. So you have to clubs together and make a conclusion. This is what called as meta-analysis. Here the increased statistical power, identify the source of variation of the study result. Drawback is heterogeneity. So if the European countries population, the lifestyles are different and food habits are different. If the event is occurring there, may not be occurring even in India. So that is the different drawback in this particular meta-analysis. So that is about the detection. So once if you identify the adverse drug reaction or adverse drug event, now you need to evaluate it. This is what called as evaluation. Evaluation means whether the particular event is because of a drug or not. How you came to know? You came to know by doing the de-challenge and re-challenge. So de-challenge is if you have suspecting that this particular drug has created this event. So you have to ask the patient to not to use the continue the same medication. This is what called as de-challenge. Stop the continuation of the medicine. That is de-challenge. At the same time, if the patient is subsiding the event, that clear that the event could be because of this particular drug only. And in later if the patient is approving, then again you can reintroduce the same drug on the same patient. That is ethical issues will be there. On the voluntary consent of the patient only you have to re-challenge it. Okay, so in the re-challenge also if the same event is occurring, then you are concluding that this event is because of the drug only, that this particular drug only. This is what called as evaluation. Okay, evaluation of adverse drug reaction or adverse drug reaction or adverse drug event is called as evaluation by doing the de-challenge and re-challenge. And the third activities is understanding. Understanding means is it any other causes are there in this particular event or not? Is there any other causes like causality assessment? Is this a definitive cause or something else? This is what called as understanding. So this causality assessment can be done in so many scale, like WHO scale, Naranjo ADR probability scale. So these are the two scale which are most widely used scale for allopathy system of medicine. Even for Ayurveda also these scales are used, but some of the scale parameters are not opt for Ayurveda. Like any blood parameters are increased or decreased. Okay, so that is very difficult to conclude by Ayurvedic drugs. Okay, so even in our Department of Ayush and Pharmacovigilance Center, they are actually bringing a new scale, but it is not approved yet. And here, actually, how close the relationship between the drug and the event? Did the drug cause the event or something else? How likely is it that the medication is the cause for this problem in this particular patient? So this will be analyzed in this particular understanding causality assessment. So here you can conclude that event is could be because of this or something else. This is what called as understanding. So this is what the WHO Uppsala Monitoring Center causality assessment scale. Here there will be a different score will be there, like certain, probable, likely, possible, unlikely, conditional or unclassifiable, unaccessible or unclassifiable. So based on the assessment, for example, event of the any laboratory test or abnormality with a plausible time relationship to the drug. So you can conclude that the event could be because of a certain, cannot be explained by the disease or any other drugs. So there is no role of other drugs, only this drug only. So this is what called as certain. So like this only the scales are there. And second scale is Naranjo ADR probability scale. Here also there are some score will be there. Like are there any previous conclusion report on this reaction? If it is yes, definitely go for the positive. Did the adverse drug reaction appear after the suspected drug was administered? Did the ADR improve when the drug was discontinued? This is what called as re-challenge. Did the ADR appear re-challenged? That is re-challenge. Are there any alternative cause for this ADR? Did the reaction appear when the placebo was given? So this is a very detailed study of the event. Was the drug detected in blood at the toxic level? So this may not be suitable for Ayurveda. Was the reaction more severe when the drug or the dose was increased, or less severe when the dose is decreased? This is unethical, so you need to take the consent. Did the patient have similar reaction to the same or similar drug in a previous exposure? So was the drug ADR confirmed by any objective evidence, like any X-ray or any other parameters? They conclude that this could be because of drug. Okay, so these are the score. The score is more than 8 are highly probable, 5 to 8 are probable, 1 to 4 are possible, 0 is doubtful. So based on that, you can conclude it. So these are the activities. Now we need to understand: is there any references or says or explained in Ayurveda? So what are the parameters are explained to prevent these particular consequences in Ayurveda? That we will discuss now. So to understand this, first we need to understand what are the causes of adverse drug reaction in modern science. To conclude that causes of adverse drug reaction, we can conclude that the overdose, excessive effect, drug interaction, drug intolerance, idiosyncrasy, drug allergy, and drug polymorphism. So these are the factors which will create adverse drug reactions in modern medicine. Could be a overdose, could be excessive effect, could be interaction, intolerance, idiosyncrasy, drug allergy, and drug polymorphism. So these are again the same parameter even explained in Ayurveda. So these are the similar as the concept explained in Ayurveda, which is based on involvement of various stakeholders in the therapy, like Dravya, the drug-related adverse drug reaction, or heterogeneity, Vaidyakruta could be because of the improper administration or improper follow-up by the patient. So all this will lead to the unintended response in Ayurveda. We'll discuss one by one. The first one is drug. Here the factors under drug are overdose, abheshaja, that is non-drug related causes, drug tangible property, drug toxicity, ahitatama dravya, that is incompatibility, idiosyncrasy, materialistic and GMP concern. So they are related to the drug which is explained in Ayurveda. The first one is overdose. So this overdose can be of two types, that is intentional overdose or unintentional overdose. Intentional, like example, drug abuse. Like for abusing, like very good example is asava, like drakshasava, for making or the kick the some of the individuals are taking the asavas for the these purposes. So this is what called as drug abuse. So ultimately they will claim that this asava has created this event. They will not told that this I am taking the overdose. So this is what one of the parameters where adverse drug reactions are occurred in Ayurveda. Unintentional example is OTC. OTC is over the counter. So without prescription, the patient will go to the pharmacist and take the medicine, and they will take it. So ultimately, there may be a dual prescriber. For eye, they may go for one physician. For oral, they may go for one physician. For the skin ailment, they will go for the other physician. And some of the physicians will prescribe the same drug. For the Agni, they may be given the Chitrakadivati. The Chitrakadivati, the three physicians are advised. At the same time, the patient will start taking the Chitrakadivati. So ultimately, it will create the overdose. The multiple prescriber, or improper roga assessment. So all this will lead to the overdose. One more very good example is one drug for multiple diseases. So this also we need to understand. One drug in different diseases. Like ekam ajirnam gulmeshu dve vishuchyam pradayet tistrasra sarpadushte tu chatusraha sannipatake vati sanjeeviniyati manavam. So he Sharangadhara says that sanjeevini vati for one disease the dose is different, for other disease the dose is different. For for amajirna the one vati of sanjeevini vati is advised, for two gulma, and similarly the snake bite 3. So they have advised it. And Sannipataja Jwara, Sannipataja Vikara, 4 tablets need to be administered. So this is what the different dose. So if you are improperly assessed it, ultimately there may be a chances of overdose. Second category which is explained in Ayurveda is Abheshajam. Abheshajam, the definition is Abheshajam iti dneyam viparitam yadaushadhat. The substances which are antagonist in action to the medicine or therapy are called as abheshaja, which is not to be used as a medicine, but you are using this particular drug as a medicine. So that is what called as abheshaja. Na abheshajam iti abheshajam. Tad sevyam nishevyam tu. So that particular drug is cannot be consumable. So if you use that particular medicine as a medicine, ultimately you are creating the disease. This is what explained in Charaka. विपरीतम रोगजननाम लक्षणार्थकारी इति अभेषजम चक्रपाणि टीका. So this abheshaja is of two type. Abheshajam iti dvividam badanam sanubadanam charaka. So this abheshaja is of two types, that is badana, that is life threatening, sanubadana cumulative poison. So life threatening has given example of visha, agni and sharp instrument. So instantly this particular instrument will kill. So similarly this is also abheshaja. Sanubadana, that is cumulative poison, viruddha ahara, ati ekarasa sevana, overdose. So all this comes under sanubadana. So cumulative poison. Day by day you regularly start using it, so ultimately you will end up with a disease. So this is what explained in Ayurveda. So hence the terms of pharmacovigilance may not be there, but the context and informations are elaborately explained in Ayurveda. One more reference with respect to the drug, Ahitatama Dravya. Ahitatama is unwholesome drug. These may be beneficial in some instance or at the particular roga avastha. Example is fruit bitten by the poisonous cobra. He has given Pana Bhojana Samyukte Vishamashme Prayojayet. Yasmin va kupitam sarpo vishrujyadyo phalam visham. The fruit is bitten by the cobra is medicine in udaravastha, or which is medicine in the treatment of udara. But this particular fruit may be act as a poison in normal individual. So this is what they have explained. So this, even though if you are not properly understand the disease or properly understand the rogavastha, so if you are using the drug, so you are creating the disease. So that's what he has explained. So you must understand the rogavastha proper way and use the disease. So this is what called as unwholesome drug, which will create the occurrence of adverse drug reaction. And the tangible properties explained in Ayurveda. In addition to this, to the primary and desirable therapeutic effect, every drug exerts the secondary effect. So the particular drug, it is known to reduce the disease, but at the same time it has a dual effect on other system. So this is what called as tangible property of the drug, dual effect. Every drug has this mechanism. So this effect may be beneficial or harmful. Very good example, Bhumya Malaki. So you know the Bhumya Malaki is a liver tonic. Okay, so it can be used in liver cirrhosis, alcoholic liver, okay, or even in Jwara or Kamala. Okay, so many varieties you can use the Bhumya Malaki. At the same time, this particular Bhumya Malaki is Vatakaraka. So if you used in Bhumya Malaki in Vata Prakriti Purusha, so there may be a chances of either aggravation of the disease or Vata Prakriti will lead to the other disease. So you are claiming that Bhumya Malaki has created the disease, but you are improperly assessed the condition as well as the person and the roga. So hence you need to understand very carefully, then you have to use, ultimately you will prevent the occurrence of adverse drug reaction. And at the last, the quality concern, so improper preparation, adulteration, substitution. So ultimately, this will lead to the, and this particular, how you need to prepare, very beautifully explained in Ayurveda. So if you prepared according to the Ayurveda, you will not get the adverse drug reaction. And idiosyncrasy. So this is different to the different individual. This is different, like individualistic effect. The ADR not by the drug-drug interaction. So here is the occurrence of adverse drug reaction is not by drug-drug interaction. Here because of the genetical hypersensitivity, drug allergy or immunological hypersensitivity, or some other mysterious effect will be there. So idiosyncrasy in modern pharmacology are actually failed to explain. In some individual will show the hyper action, hyper effect. Some will doesn't show any effect. They actually called it as a mysterious or idiosyncratic reaction. But in Ayurveda, this particular concept is explained very beautifully under the one condition or one umbrella called as Prakruti Viruddha. The Prakriti Viruddha Dravya Prayoga. Like Pitta Prakriti, if you use Balataka, so you will end up with this particular disease. So they have explained it. So this is what called as idiosyncratic reaction explained in Ayurveda. And even Anupana, so if you are not following Anupana, Sahapana, so all this will lead to the drug-induced consequences in Ayurveda. And Vaidyakruta, you all know there are three types of Vaidyas, Charmacharya, Siddhasadhita and Vaidyaguna Yukta. So if the improper learned physician, so if they are adequately diagnose it, improperly administer the drugs, ultimately, so they will lead to the occurrence of adverse drug reaction in Ayurveda. So these iatrogenic ADRs may be due to the failure to ascertain the quality of the drug, wrong selection of the patient, improper diagnosis, improper drug administration, or improper follow-up will lead to the failure of the treatment. So hence you need to very cautious even in this particular category also. And apatyas while aushadha sevan. So this is also they have explained. Like lashuna sevana. So what should not be consumed? Atyanta jalapana, paya, guda. So these are contraindicated. So if you consume during the time of lashuna sevana, so definitely you will end up with disease. So this is what explained. And even in contraindication during Gandhaka Sevana, Kshara, Amla, Taila, Savira, etc. Contraindication during Gugula Sevana, Amla Rasa, Tikshna, Ajirna Karaka, Dravyas, Maituna, Shrama, Atapa Madhya, and Krodha. All these are need to be contraindicated. If you administer, so definitely will end up with the failure of the therapy or drug may not show any effect. But you should not claim that this effect is because of Ayurvedic drug. It is improper administration. And even in Farada Sevana contraindicated, like Kukurashtaka members, Kukurbitese member, Kakarashtaka, and contraindication during Shilajatu, Kulatta, Kapota Mamsa, Pashana Veda, etc. So all these are explained. I just given few examples. There are so many, examples are written in Samhitas. And next, which is explained very beautifully in Ayurveda, is drug interaction. So the drug interaction is nothing but the modification of the effect of one drug by prior concomitant administrations of other. So this is what called as interaction. The factors are multiple pharmacological effect, medical pluralism, that is multiple prescription, patient non-compliance, and the abuse. So this will lead to the interaction. Mixopathy, Ayurveda for one disease, allopathy for other disease. So you concomitantly, if you mix the drugs, so there may be a chances of interaction. Here the example, phenytoin. The phenytoin, which is a anti-seizure drug, anti-epileptic drug. Phenytoin, there may be a tendency that Shankapushpi, it is very well-known Shankapushpi drug for the management of brain disorder. If you combine the phenytoin with the Shankapushpi, the effect will be, instead of reducing the seizure, there will be a no loss of seizure control. Okay, there will be aggravation of the seizure. So this will be seen. So you should not claim that Shankapushpi has created. So it is created by the Vaidya. So this is what the importance. And one more example, prednisolone, which is a steroid drug, along with the ST madu. So if you administered this dual combination, increase the plasma prednisolone concentration. So there may be a chances of prednisolone toxicity will be increased. So this is what they explain. And same explanation even in explained in Ayurveda, the concept of Viruddha. There are so many varieties of Viruddhas explained, 18 types of Viruddha. Kala Viruddha, Mana Viruddha, Vaya Viruddha, Prakriti Viruddha, Karma Viruddha, okay, Mana Viruddha. So many varieties are there. So all these Viruddhas are explained only this purpose only. So if you combine these drugs, there will be create the diseases. That's what they explained. Like, Madhu with Ushna Jala is contraindicated. Uncooked meat with bile, Sura plus Kshara and Payasa. So these are examples. Karma Vriddha, Kapota Mamsa, Shapataila. Okay, and other explanation available in Ayurveda, Avasthanusara Dravya Prayoga and their effect. Like Ardraka is contraindicated in Grishma and Sharad Rutu. So if you administer, that's what in primary slide, there were report suggested that ginger has created the thyroiditis. Or so that is could be because of the Ardraka which is used in Grishma and Sharad Rutu. So this is how you can explain. Even though the reports are coming, the improper use of this particular medicine will create the diseases. And Ayoga Rasayana Sevana, okay, contraindications of Anjana, contraindications of Apatarpana, contraindications of Dadi, Sharat, Grishma and Vasanta Rutu. So if you use, there may be a chances of aggravation of dosha and vadi. Patient-related adverse drug reaction occurring in Ayurveda. For the therapeutic success, the patient also plays an important role and he must be Pisha question. The ADR may result if the patient does not follow the physician instruction. Violation of drug or treatment regimen during drug overdose or drug abuse and polypharmacy are common behavior of the patient. So these are the other key factors for the failure of the therapy. So improper follow-up by the patient also will lead to the disease. Complication, in spite of the proper care, all the aspects, the complications may arise during the course of treatment, like Panchakarma Vyapat. So the very beautifully they have explained. So that is what if you are thoroughly studied the science, thoroughly treat the medicine with the proper medication, ultimately you will create a wonder. Otherwise, you create a disease. And Panchakarma and their role in ADR. So according to the Edwards et al., he actually included the materialistic ADR as a one of the cause for adverse drug reaction. So even in Panchakarma, the materials, there are so many materials are used, Basti Yantra, okay, Nadi Yantra, etc. So inadequate, in Ayurveda, they have explained inadequate, that is Ayoga, Atiyoga, contraindication, that is Anarha, Vyapat. So all this will actually helps us the importance of, how you can prevent the drug-induced and therapy-induced consequences and preventable in Ayurveda. So such consequences are mostly because of the faulty preparation of the drug, improper assessment of the patient, resulting in failure of the treatment or the drug-induced diseases. And these are iatrogenic. So these can be classified under the drug-induced, that is Dravyataha, patient, Roga Sambandhi, etc. Iatrogenic. Okay, materialistic cause like Basti Yantra Dosha. Okay, all these are comes under materialistic area. And is there any Daiopashya Chikitsa role in Ayurveda to cause the adverse drug reaction? Yes, Ayurveda has explained Daiopashya Chikitsa very beautifully and it has a unique role in management of the disease. Like Daiopashya Chikitsa, that is spiritual therapy, and Sattvavajaya Chikitsa, that is psychic therapy, are important modalities of treatment for psychogenic pathologies in Ayurveda. Manasika Vikar. They include mantra, money, yoga, mangala, music, etc. are the prescribed as a part of these psychotherapies, which are to be advocated diligently based on the stage and pathology of the disease. Any improper administration of these methods may favor the occurrence of adverse drug reaction. So you have to chant the mantra according to the classical text only. If you are chanting, irrelevantly, ultimately it creates the disease. Here one very good example, which is published in European Journal of Cancer Care. So effect of an integrated yoga program on chemotherapy-induced nausea and emesis in breast cancer patient. So this is very reputed journal. So they actually conclude that the study is reported a headache with failure of the treatment with improper administration of mantra, that is chanting a mantra in patients of breast cancer. The chemotherapy along with the mantra they was advocated, but improper chanting has created the failure of the therapy. The chemotherapy itself is failed. Instead of reducing the breast cancer, the drug has failed as well as worsening of the condition. So hence, even the Sattva Vajaya Chikitsa is also plays a very important role as explained in Ayurveda. So that will also lead to the occurrence of adverse drug reaction explained in Ayurveda. So all these informations are even available in one of my article, which is published in Journal of Young Pharmacist, Adverse Drug Reaction and Concept of Drug Safety in Ayurveda. And this is my book, which is published in Chaukamba. It's available in market. So all these informations are there. Okay, at the last, the preventive measures. So how you can prevent the occurrence of adverse drug reactions in Ayurveda? So as you all know, Ayurveda emphasizes on safe treatment. Hence, to prevent the drug-induced illness, many restrictions have been suggested before prescribing the drug, like GMP guidelines, guidelines for drug administration in Ayurveda, drug surveillance study, or unbiased drug information like proper drug informations of Ayurvedic medicine, including ADR, must be readily accessible to the practitioner as well as lay public. So you have to make the drugs. This particular drug is not suitable for Pitta Prakriti. You have to label in the medicine. So that is what the importance of. So thus you can prevent the Pitta Prakriti person uses of that particular drug. So that is what the important. And you have to minimize the polypharmacy. So this practice is believed to be one of the main cause of drug interaction and need to be addressed with a appropriate policy and education. And OTC practice, so this is over the counter. So this need to be make some policies. Some of the Ayurvedic drugs without prescription should not be make available by public. So because this will lead to the bad name to the Ayurveda. So that is need to be make some policies so that you can prevent the ADRs. Informative paucity in herbs of Ayurveda. The only few studies have been published regarding the adverse effect, contraindication, disadvantages, and toxicity of the herb. So more information need to be generated and made freely accessible to the public. So hence you can prevent it. And awareness and active participations of the health workers and mandatory reporting. All the health workers are made mandatory. So it must be made mandatory for practitioners to report the adverse drug reaction if at all found in their routine practice so that enough data is generated. And at the last, the research is encouragement. The PG and PhD scholars need to be encouraged, or even UG student. Nowadays, university is providing some fund for UG research also. So for there also, you can motivate the students to go for such kind of studies so that you can, prevent the occurrence of adverse drug reaction in Ayurveda. The ultimate benefits of this implementations in Ayurveda, the benefits will be patient care. So you can minimize the occurrence of adverse drug reactions in Ayurveda. Ultimately, the financial burden to the patient will be reduced. The physician will get the with the minimal drugs create a wonders. He will get the name and fame and the science. So hence, if you create this particular drugs, minimal drugs, maximum effect, our Ayurveda science will become globalized, and all the other allied science people will come into look into towards the Ayurveda, and ultimately the public will get the larger benefits. And pharma industry, if you prepare the drugs according to the classical, so your drug will become more popularized, and your company will become, more popularized as well as globalized. So hence, the quality drugs need to be prepared according to the Ayurveda. And the last one is policymaker, and the government will make some regulations so that the globalizations of science can achieve by doing or implementing the pharmacovigilance. Okay, so that is what the importance of pharmacovigilance. I hope it's clear. So pharmacovigilance is nothing but it is detection, evaluation, understanding, and prevention of adverse drug reaction. There are so many factors or methods of detections of adverse drug reactions can be done, and in Ayurveda it has been explained very beautifully, and he has included so many factors to cause the drug-induced toxicities. But the term pharmacovigilance may not be there in textual reference of Ayurveda, but the information which are similar to the adverse drug reaction are explained every books and every sentences of Ayurveda. So and even in Ayurveda it has given utmost important for the safety and care of the patient. So hence the pharmacovigilance will help the science make more safer and globalized. Thank you. I thank the organizer for inviting me to share my views. Thank you. So any doubts?
So we have few queries, sir.
Okay.
Like one question is like who governs the pharmacovigilance?
Sorry, I could not hear you.
Who governs the pharmacovigilance?
Governance. It
Who
is a
governs?
department of governance. No, you are asking.
Sir. Who governs the pharmacovigilance?
Department of Ayush. The Department of Ayush is actually the loan department where it will take the decision, and it has made the National Pharmacovigilance Center. So once the National Pharmacovigilance Center make the decision, it will take the decision in accordance with the Department of Ayush. There
Okay.
the secretary are there, and the Department of Chair is there, Ayush Chair is there, and Ayush Secretary and Ministry of Ayush. So they will count the pharmacovigilance program.
Okay, sir. And there's one more question, sir. Can modern medicine induced ADR can be cured by Ayurvedic medicines?
Yeah, definitely. See, we have to assess the any disease based on our science only. Whether the which dosha is aggravated, which dhatu is involved. So based on our science, you have to assess the condition and you have to use the drug. So that is what. So you have to consider any disease, any reaction like a disease, like how explained in Ayurveda. Then you have to use the drugs. Definitely, we can create the or you can cure the diseases by allopathy drug-induced toxicities.
Okay, sir. And once again, we all thank you, sir, for accepting our invitation and giving your valuable time, sir, and also for
Thank you.
explaining in depth about importance of pharmacovigilance in Ayurveda and consequence of these adverse drug reaction, and also for highlighting how to detect, report, evaluate, understand, and prevent these ADRs, and clarifying the misconception which is very common that Ayurvedic medicine does not have any side effects or there is no expiry date, and also explaining the different aims of pharmacovigilance, sir. Thank you once again for sharing your
Thank you.
knowledge, sir.
Thank you so much.
And tomorrow we have two more sessions, and the first session will be starting at 10:30 to 11:30, and one more session from 12 to 1. And the same link will be sent in the WhatsApp group. Please join the group using the link. Okay. We'll continue in the next session tomorrow.